So let's get into the conversation today. Well,
Hello. Thank you for having me.
you are welcome. So glad to be here. So we're going to get right into the conversation because mammography is a really hot topic and you talk a lot about it you go in depth. You talk about all kind of things like the positioning, why you want to be a technologist, why you want to transfer over into mammography, because I think it's really important because when I search mammography technologist, I don't find a lot on social media. So to see you and see you so articulate about so many variety of pathways in the field, I think sometimes we as technologists, even us in the field, I'm not just talking about people coming through school, but those of us that are in the field, we say, I'm burnt out. I'm only doing x-ray. I don't want to do CT. It's too high paced. I don't want to go into education, but I want something a little calmer. I want something that's not so physical. And I think memo just goes right over people's heads. So let's even talk about those of us in the profession who maybe can have a fresh look at mammography. So that's what I want to touch on today. So welcome.
Thank you. And I
So
do agree with that.
how did you know you wanted to do radiology since the 10th grade? I need to know.
So my parents always pushed the medical field onto me. They're not from the medical field whatsoever. They came from Mexico. So first generation kind of a thing. They said stick to something in the medical field. So doctor was out of the question because my family has no money. Nursing was an option, but I don't know. There was just something about nursing, how you really have to take care of your patient, like their entire life is in your hands, kind of a thing that really scared me. And then we had some very far relative that was doing the x-ray. I spoke briefly to her. She didn't really provide me with too much details. But then in high school, in the 10th grade, my school was providing a internship at a hospital. So very, very small, super small hospital. And when I went in, everyone was assigned to different departments, and I specifically asked to be placed in X-ray. So they gave me permission. And the very first day that I went in, they rolled me into the OR. They had me strapped on, lead shield, everything. I saw them open up the spine. I saw them use the C-arm. And I was like, yep, this is what I'm going to do. This is exactly what I'm going to do. I still remember the smell of like the skin being burned. And I remember being fascinated by it. And the tech was just like, don't fake. Whatever you do, don't fake. And I was like, no, I'm not going to fake. So that was really cool. So from
You
there
are
on,
hardcore. If that didn't scare you, they took you straight to the OR. Oh my goodness.
yeah, that was a lot of fun. That's a really nice memory that I have. And then from there, like I would go into OR cases and just help them. And by help, I mean like I would just stand to the side next to the C-arm. I had no idea what anything was going on. The only other thing that they let me do was clean the machines, stock the supplies in the x-ray rooms. I did get to see mammography once when I was there, and it was through film mammography. It did not catch my attention. No,
Yeah.
none whatsoever. I was like, nope, I want to be in the OR. I want to be in the
Me
OR.
too. I'm not gonna tell a fib here. I'm the same way. Mammography just I was like, nope, nope,
Mm,
nope, nope. Didn't really have a basis for that, no, but I just was like, no, no, no. So
yeah.
you're not alone on that. But we've all kind of you never say never what we've learned, right?
Yeah. No, I specifically said I'm never doing mammography. Like that. But to be fair, the tech that I was with, she had never had a student with her or like anyone there. So she was super quiet. Nothing was explained to me. So I had no idea what was going on versus an x-ray. They were like, okay, we're going to do an x-ray of this elbow. We're going to do an x-ray of this. This is how you position and everything. So that definitely plays a factor into
That
it.
is a huge factor. I'm glad you mentioned that because so we're going to remember that because we're going to get into that because I do want to talk about that when you're talking about going over into mammography as a technologist, someone new. We know how it is to go into new modalities. It's scary even if you're not a student, you're a technologist for years. It's a little because you know how people are when you're trying to transition over to their job. Some people are like, not welcome. And some people are like, come on over. We'd love to have you. I'm going to show you everything. And then you got some people that's just like, I'm in the middle. I'm neutral. I don't care.
Yes,
So
essentially.
I want to be helpful to the students in high school because I think that is a wonderful thing that you knew in high school that you wanted to do radiology. So if someone is looking into the medical field or into radiology, particularly a parent, a child, what can they do? What steps can they do? And I know each state is going to be different, you guys, but just kind of listen to what Zulima is saying about how she navigated high school and it led her to the radiology profession. Maybe you could take some things and then reach out in your state and see what is comparable.
So my high school was very big on having all their students take community college classes while we were in high school. It was kind of mandatory through our schooling, but that played a big factor because even though I really wanted to do x-ray and none of my counselors knew anything about x-ray or even anything remotely, I simply focused on being able to take community college classes I could transfer to another community college once I graduated and or university. And I focus on science classes and then just your general ed. So by doing that, I knew that by the time that I graduated, no matter where I went to school, it would completely transfer over. And then I could just focus on the x-ray only portion of classes. Because most programs, again, every state is different, but most programs, at least near me, you have to be at least 18 years or older to
Right.
be able to even apply to the program. And I was nowhere near that. So I just focused on what I could do, which was general ed and then your science classes. So that's what I did beginning 10th grade. Every single semester, I would take at least one college class during the summer, two, during the winter, two classes until I graduated.
Soon did you start preparing for the 10th grade to do that? Was that something you did in the 8th and ninth grade or?
No, beginning of 10th grade. Beginning of 10th
Okay.
grade. So 10th grade, I started taking college classes in the spring. So I learned about it in the fall, and then fall and winter semester, I was trying to figure things out. My counselor helped me. And then by the spring, I started to be enrolled in these classes. And it was just one class at a time. I didn't do more than that. Only during the summer and the winter, I would take on two college classes. That's it.
Did you go
But
to a special high school or was this just a normal high school?
normal high school, normal high school, but they were very big on education and university. So they really pushed that onto us. But I knew what I wanted to do. So I knew that didn't matter how much university they pushed on me. None of the universities around me have x ray. So it was not going to work out for me. So I simply focused on what I could do.
Well, that's very good that your counselors, and I thought that was interesting that you said the counselors, when you told them about radiology, they were like, what is that? So obviously there's work we need to do in the school
Mm.
system because it's still the same. When I was growing up, most counselors, you want to work in medical? Be a nurse, be a doctor. And there are so many professions. My mom's best friend, her and her husband were both respiratory therapists growing up. I assumed they were nurses. My cousin, he was a director in radiology when I was going to school for radiology. I'm like, "You're a what? How did
Radiology?
I know that? I just knew you had on scrubs."
Whenever I see someone that scrubs, either doctor or nurse, that's no idea of anything else
Anything
related to the
else.
medical
So
field.
how are young people in high school supposed to have all the options available to them if even in high school, the counselors don't know what's out there? So I love that you talked about this. So let me ask you this question because high school, when I was in high school, which is a while ago, they had different pathways you could go. So if your mind was more of an engineer pathway, that's the type of direction from the 7th or 8th grade I was directed. I had more of a science math. So all of my courses were more science directed because I tested and it showed that I was a more science directed person. That's the kind of direction all of my courses went towards those. So when I did go to college, I would have enough for that particular direction that I was going. So by the 7th grade, my counselors kind of helped me to decide you want to go in more of a health science direction because that's what I like. That's what I tested well on. That's what led me. We didn't have a program like that until after I graduated in the state of Georgia, where you can get at one time it was unlimited college credits for free
Wow.
while you were still in high school. You didn't even have to wait till the summer. So we have that now, but now they've cut it to I think 32 only you can get in your last 2 years of high school, which is still
That's
great.
still pretty good,
That's still great, but it was no cap before. So if you were really smart and focused like you were, I mean, you can knock out a lot of stuff, especially if you got a lot of your high school things. So what it takes is parents and children communicating and being able to shadow and learn about these different professions like radiology, and then working towards it in high school and finding out what programs your school system and your high school have available to you, right?
Yeah,
And
absolutely.
so after you oh, go ahead.
And in my high school, it was a brand new high school that I went to. So, like, I was the third graduating class from that high school. So it was brand new. So everything was barely being figured out. We didn't have any type of pathways, like how you mentioned that you had health science, engineering. We had none of that. So we were all kind of just trying to figure things out. So even the hospital program was brand spanking new. They were still trying to figure things out. There was nothing really to guide us. Again, it was kind of just figure it out as you go along the way type of thing. But it was nice. And if parents are involved, I think that's great. But the wonderful thing is that we have social media now and everyone's on social media. So at least I feel like a lot more high school students can an effort into not just scrolling, but maybe finding different careers and at least getting a little bit of insight of what X-ray is and how I can help them and everything.
And how to start early. Start early. Don't wait till your senior year. If these things are available, and then also they can have tools to go to their college counsel, high school counselors, go to their teachers with and say, hey, I heard about this radiology program. And it's at universities, it's at colleges, because some parents want their children to have a university degree. Some parents are like, whatever, but we know to go to school for what we do in radiology, you must have a 2-year degree. You graduate with at least an associate's. And there are other pathways to go. We have 11 specialties, and you have mammography. So, how can someone, you talk a lot about pursuing mammography straight out of x ray school. I'm a big proponent of making sure you have at least one extra specialty outside of diagnostic radiology. And the reason I say that is because when I was going to school 22 years ago, this month makes my 22nd anniversary.
Wow. Look at you
I'm
go.
so I wanted to do something. I guess I need to like get some balloons or something to
Yeah, do a little 22 in the back with a cake.
because
Yes, absolutely.
it's been a long 22 years and I still got some years to go.
And you still love it. Most
And I still
importantly, you
love
still
it.
love it. You
It
know,
has been a blessing to my family. My husband does it as well. And I was telling my hairstylist this morning how amazing this profession is, in my opinion. But I
yeah.
love how you advocate that going for mammography right after x-ray school is important. While I was in school, my first year, I finished everything in the first year. All my clinicals gave us 2 years to do it. I did it in the first year because I knew I did not, and I kept my mouth closed because I didn't. It wasn't wrong, but there was nothing in writing that said I couldn't do it, but there was nothing in writing that said I could. Like throw it and just stay focused and do your thing. I didn't let anybody see. I just get them to sign off where I needed them to sign off, and I closed my book. I knew once I got into the profession. Oh wait, I can do this. I could do that. I could do that. Oh, that's a lot of stuff I could do. I had plans to get every specialty because back then you didn't have to take the comps. You just paid the 150 and passed the test.
Oh, wow.
Yeah,
Okay.
that's why you see some men with mammography registries. They've never done a mammogram in their life. They
But
just
I love it, and they have the M behind their name. I've
they like
seen that.
initials. They like
Yeah.
initials. But now you have to actually do the comps to pay for the exam and take it. But that was my plan to get every letter behind my name too. But they changed the rules by the time I graduated. But I tell people get at least one, whether you do it or not, whether you want to do it or not. Give yourself another option while your brain is still in a study mode. What is your take on that? Why straight after x ray school?
I agree with that mentality because that's the only reason why I got mammography. Because my school offered mammography and they made it clear that if you were a female, you could graduate with your x-ray and mammo at the same time. Even though I did not like mammography, I was like, just get it. Just have it, just in case. And again, in my head, I just saw it as like an older generation type of thing. Like, this is not a field that I'm going to be touching anytime soon. I'm going to be doing this when I'm close to retirement type of thing. But I was like, let me at least have it. Let me just have it. I'm very glad I did that because I did not expect it to be the way it did. But yes, but mammography compared to other fields is just a lot easier to get versus CT, MRI, because I believe even the programs around me, they take about a year because to get all the studies and everything, it takes time, right? It's not easy, but mammography, it's just boobs. You know, and we're pretty straightforward.
And the
Everyone that does
principles.
mammography can, you know, you can get your exams, at least the amount of exams needed to get your license a lot quicker versus other fields. So that's the
And
only reason why.
And I'll say this too. I feel like CT and mammography are easier to get because you're already coming from a radiologic technology, a ionizing radiation mind frame and study. So while your brain is on that pathway and all that stuff is fresh in your mind, it's the same principles that you're learning from x-ray school, radiology school over to mammography school. Same principles. It's just you're just focusing on one body part and a
Exactly.
lot of QA.
Yeah.
That's the only difference to me. So your brain has already learned a lot of that stuff. That's why it's easier for me when I went from X-ray to CT. It was not my plan, but I'm so glad I did X-ray to CT because my brain already knew about all of that radiation biology and how radiation worked. That stuff is still fresh in my head. I just went over to CT, boom, oh, this is good. It was just cross-sectional was the
Yeah.
difference. We don't learn cross-sectional X-ray. So that was different, and the machine process and the protocols was different, and the calcium score and that kind of stuff. MRI, when I went to school for MRI, that's nothing to do with what
No,
we learned.
no, that's
No,
completely physics completely different from that. Yeah.
it's like, really? Like, I don't I try to and I try to tell people, if you go from X-ray to MRI and go back to CT, you going back to school again. Just go X-ray, CT, do all the radiation stuff first, and then jump over to nuclear medicine or radiation therapy or MRI, because those are just different principles. They're not the same science principles. So with mammography, I think that's why it makes sense to go right after X-ray school from to mammo, CT, X-ray. Those three are like little close family members. They're first cousins, I call them.
Mammography is great. And I really do think it's just depending on where you live and how easily you can get into a clinic that you can get your exam, it's just a lot easier. And my brain also, it just understood it a lot better. It just understood it. There's only so much as far as breast is concerned that you can learn. So it was a lot easier to grasp. But again, it was not in my plan. My plan was to graduate X-ray, have the mammo license, and then go back to school for CT. But I
Oh,
wanted to give myself at least a year of being in the field practicing before I did that. Never did that. Went straight for mammography and I ended up just sticking there.
what do
Yeah.
you think it was that made you stick with mammography?
I realized that it was something that I thoroughly enjoyed. I enjoyed my interactions with the patients. I didn't fully understand it when I first started it and everything that goes into it, but I was still very, very curious about it. So I figured, well, why not? Why not pursue this for another year and see how it goes? So that's what I did. I told myself, give yourself a year, fully commit to mammography. And if after the year you don't like it, then that's fine. It's not the end of the world. And here we are 10 years later.
And
So,
I think that's important because you did not force yourself to feel rushed, but you kept yourself focused that I'm already in the school, get something that's being offered to me. Why would you not take advantage of something? It just made total sense. The time period of you being able to get another certifications, because certifications mean more money. One thing
yes.
I think people don't know about mammography, because I know a lot of mammography techs who have been doing it longer than me, and I'm gonna tell you they make more money than me.
Yeah. Yeah. I was going to mention that too. It's a specialty. So you get paid more. You get paid more.
And what
So,
people don't understand is the specialties that people sleep on are the ones that usually make more money,
yeah.
because people, I think it takes special people, not I think, I know it takes special people to do mammography. I'm going to say that. It does take special people. I do breast MRIs, and I've had my own mammogram since the age of 24 because of lumps and
Yeah.
issues in my life. So I know how stressed I am when I go get mine. And when
Mhm.
I've had mammo techs who have not been so nice, I'm like, hey, look, I'm a patient first, but I'm also a technologist. Let's wrap that on up because I'm stressed out. I know
Yeah.
you're stressed.
Patience. Give me patience.
I'm really stressed because I got
Yeah.
a lump sitting in me, and I don't know this time if it's cancerous or not. Every time I have to come back, I don't know if it's cancerous or not. Every time I come, they find something. So I'm already stressed. I do appreciate the technologists and what they do. I know what it means to be a technologist. I know what it means to be a patient as well, and to have technologists like yourself in the mammo field who care about the patients. So you do have to have a level, because when my patients come to me for MRI of the breast, it's usually because they do have a really
Yes.
bad tumor. Yeah. Sometimes it's just genetic testing that they've had and they want to monitor it, but majority of the time, whenever I
Usually.
do breast MRIs, it is really bad. It's like really bad. When they come for the MRI breast, those are some of the worst. And I worked in a cancer center in CT my first 9 years of my career. And yeah, breast MRIs kind of took me back for, to reality of what women go through and what mammography techs have to see. So I feel, it does take a lot of patience, kindness, empathy for this job. And you guys are compensated. And it's a lot of work, because when I went to get certified in it, that's the other thing I want to talk about. I don't wanna hear anybody say, "Oh, all they do is grab breasts and put" no, honey. I'm
No.
dealing with the small breast trying to get them inside there. I was like, "Oh my goodness." So can we talk about that? Because I want to really highlight mammo in a positive light. After doing MRI breast, I chose to go get nationally certified in mammo because I felt like I wasn't understanding why I was doing what I was doing. And I don't like to be the technologist that push buttons. And the
Yes.
radiologist just says, do sagittals, and that's it. I just want two sagittal. But why? And I get all this paperwork from mammo on this person. I don't understand why we wait to after this menses to do this. What is a BRCA this and a BRCA that? But when I went and got nationally certified and actually was sitting there maneuvering the breast in there and getting all that tissue in there, I started doing my MRI breast much better. I mean,
As I right,
the
it
girl
clicks.
was clicking. It was clicking. I was feeling like a
Yes.
little pro. I was in there just the patient, and I made the patients more comfortable for the MRI, the breast. Everything just worked much better. And for me, I felt like every MRI technologist should go get nationally certified in mammography.
It
With
does play a big factor, especially if you are the MRI tech that's helping the doctor perform the biopsy. As far as understanding goes, like it helps so much. The MRI techs that I have worked with that have done mammography or that at least are certified in it, even if they're not actively in it, they perform so much more better versus an MRI tech who has no background in mammography whatsoever. And it's
it's very
understandable. It's
helpful.
understandable.
Yeah,
But if you have it, like it helps so much to fully understand what's really going on in the breast and why
yeah.
certain things are happening.
So
So
let's put this in a positive light because after I did that, the reason I said that was because when people think I'm burned out. I get this all the time. I'm burnt out in radiology, and I get it. You can be at some places that will. We talked ahead of time before getting on here. I contract, and I still get tired at some places I go to. It's work. When I was working driving trucks at FedEx, you got drama everywhere you go, y'all. I don't care if you got to work. Even at home, I hear housewives complaining and stay-at-home moms complaining. It's just called life, y'all, but we
yeah,
gotta figure it out. But our profession in mammography, I want it to really be highlighted in a positive way because I feel like it's one of those professions that people are really sleeping on and not realizing, like you said at the beginning, it's an easy way to trans within the medical imaging
yeah,
profession without having to feel like I gotta go back to school. Just
exactly.
highlight to us what a day in the life of a mammography tech would look like, because all people think about is this: "Oh, papers, I'm drowning in papers. Oh,
Mhm.
papers, QA, I gotta test this. Oh, I gotta grab on boobs, and I gotta work inside of a department full of miserable women. Oh my goodness." Now, I'm not saying some of that's not true, but that's just life.
No, I agree, and that's also the reason why I didn't wanna do mammography because I was in a department that was like that. So, especially as a student, so yes, yes. However, once you're certified and you're out by yourself and you're going into the field, you really get to experience mammography in a new light because as long as you focus on educating yourself and fully understanding what is going on with your patient, I think that's when it becomes enjoyable. So, not just doing XYZ, like you said, because the radiologist is telling us to, but fully understanding. So your patient comes in, you have to make that connection with that patient the moment they come in into your room because it's a very sensitive exam, right? So you never want to offend them in any way, but you also need the patient to fully cooperate with you, especially if they're there for a diagnostic finding, especially if it's a BIRADS 5 that you're already aware of, but the patient has no idea. So you really need to be on top of your stuff. But once you have that knowledge, I feel that's when it really starts to become enjoyable because then you really know and you know how to work around patients. You know how to work with the emotions and everything that comes with it. And you as a tech, you start to feel good too because you understand. Now you know what the radiologist is talking about. Now you can read the report and you're like, oh, okay, this is what I have to do. Like this makes 100% sense. I definitely think that's the best thing about mammography. That's what I love. I love that every patient is different. Every case is different. There's not one single patient that comes in with the exact same problem. It's going to have a very different outcome. So that's what I like. That's what I think is nice about mammography. Every patient is different. Every situation is different. It's never like the exact same steps for everyone. I do think sometimes people think that,
They
but
do.
no,
They do.
it's
Yeah.
not.
I did until I went to school for a memo, and I was like, "Wait." I had to take a breather in between, and I was out in Vegas.
Yeah.
So, I'm gonna tell you, this is it was a good teaching place that I went to, because if you're just thinking breast, you get implants. Every implant is different.
Every implant is different. And then how long have they had their implants for? Have they gotten them replaced? Are they encapsulated? Do you have silicone in the lymph nodes? What is going on with the implants? Like, is it a patient that has a full non mastectomy and then has implants and they're trying to like re-image? Like what? Yeah, it's a whole thing.
It's a whole. So when you say not every, in my mind, when I first started, it's like, okay, bloop, just bloop, bloop, and bloop, done, ding. Nah, that wasn't it. And once I got it, I got it. But every patient was different. Literally, if you just
Physically, we're different. Emotionally, they're different.
Mhm.
Like their history is super different. You can't treat everyone the exact same way. You have to spend more time with some patients versus others. There's some patients you go in, they're ready to go, very little communication. Cool, we're done. There's other patients you have to really like talk them through the entire thing. So again, I think it's fun because it's always a challenge. That's how I always say it. It's always a challenge, a new patient that comes in. And it's always a fun challenge. Like, what am I going to deal with today? And not deal with in a negative way, but like, how am I going to like overcome this and make sure we can get the best picture possible for this patient?
Yeah.
And then you throw in those patients that are in wheelchairs or in the canes or are kyphotic and that scared me in the beginning. That scared me. But the facility that I was in, my manager was very, very persistent that I did not receive any help, that I had to figure it out. Did I figure it out? No, absolutely. I did not in the beginning. The first like 5 patients that I had were in wheelchair or kyphotic or they just had some other type of thing going on. No idea. So I had to observe. It was just a lot of observing, watching what everyone else was doing. And then, okay, next patient, I'm going to do it completely by myself. And give me 20 minutes with this patient and figure this out. But then slowly but surely your confidence goes up. And then you're like, oh, patient's looking this way. Okay, well, let me just angle the machine a little bit more or let me have them this. So it's fun. I like it. That's why I like it. It's fun.
So do you
So
work? And this is the other thing people don't know about mammography is I did a TikTok, and I try to be funny but entertaining at the same time. And I did the TikTok where I have this little series that I do where people go to school for 10 years and they come out and with a master's degree and they make $30,000 a year, and then they see their cousin over there is making 6 figures doing radiation therapy, and they're like, what? Or a radiologic technologist making close to 6 figures and they got a 4-year degree and they make $50,000. So, and full of school debt. I did one on mammography about how people are sitting there following social media. And that's the one thing I like to really say, you can't believe everything on social media. And that's just, everybody knows that, but I don't think everybody believes that. And that's why I like your content, because it's not for the gimmicks. It's not for the fake. You give the real of mammography. This is how you become one. These are some tools, and you give a very positive spin on it. And you've shown there are places you work where it's like, no, I'm getting out of there. But it didn't change your view of the profession. And I think that's important because we've all had our own experiences, right? I mean, good and bad, but it doesn't change our view of what the profession has been able to provide for us and our families. And we're grateful to be able to take care of ourselves, and our bodies are still in shape. I mean, you're working through your pregnancy. Like, that is, girl.
I'm doing wheelchair patients through my pregnancy without a problem. Okay.
You
That's
got
a
the
big
one
deal.
on-
Okay. Because for some mammo techs are like, you need to have help. And I'm like, no, I don't. Once you know how to position, like you really don't. Really don't. Really don't. But yeah, it's been a lot of fun. I love my profession.
That's
I don't see myself leaving anytime soon. Maybe in the future just to like do something else I would, but right now it's perfect.
Yeah. So, and if you start, so one thing I want to talk about is a schedule for you guys. What does a normal schedule look like? Because I did the thing on Monday through, you don't have to work call holidays. And I got some people in the comments saying they work weekends in Memo and they take call. And I'm like, I can never get an appointment on a weekend. I live in a huge metropolitan city.
Okay, I have yet to meet anyone personally that takes on call for mammo because even when I was working at my breast center, the only one who was on call was my manager because she had to schedule patients and everything. But it was still online work. You never had to go in person. So I personally have no idea what those people are talking about. I've never done that. I don't know. And as far as I'm aware, As far as everything that's been taught to me, there's no such thing as a breast emergency. It can wait till Monday. It can wait till Monday. That is what the radiologists, the breast surgeons, because again, I've worked in one of the biggest breast centers here in LA, and that's has always been the mentality. So, hey, maybe somewhere else it's very different. For me personally, I've never had to be on call. I've never met anyone that's had to be on call for mammography. Weekends, yes, I do know some mammotechs that work weekends, but they tend to be more of outpatient centers, not hospital centers. Hospital centers, you typically don't. There's one big hospital in my area that does. That's why you don't work there. You're gonna want to work those kids. Don't work there. That's kind of how I always see it. Like, yes, people do say like, oh, you might have to work weekends, you might have to work holidays. I'm like, don't
How?
work there. Again, don't work there. Like, I've never had to work holidays. I've never had to work
I
weekends.
live
Well,
in a huge metropolitan city, and it is one of the where I get my breast ultrasounds and mammos done. I'm gonna tell you, I have never ever been offered. Now they'll work late to 7, but I've never been in since I was 24. Seen them offer me a
yeah,
weekend place to get my mammo done because it would have helped out working full time. I had to take off work to get my mammos done.
I did work at an outpatient center last year, and they did have Saturdays open, and they were trying to get Sundays open. And I did work like maybe 3 weekends the entire year that I was with them. And by the third one, I was like, yeah, this is not gonna work for me. So
No.
I'm like, yeah, no, I'm a mom. Can't do this. They were very nice to me. They respected it, and they ended up just closing the day because once I said no, all the other mom texts said no too.
Right, right.
So,
And
you
that's
know,
the thing. I think that's a little off topic, but that's one thing that I appreciate is that when everyone in the department, they're going to try stuff, especially outpatient centers. They're going to try to extend hours. I remember working at one place.
absolutely.
They were like, we're going to stay open till 11 o'clock at night. And I was like, 7 o'clock was when I got
I'm leaving.
7 a.m. to 11 o'clock at night. I don't care how much money you offer me. And
Mm-mm.
they were like, well, those are hours. I said, oh, you must go have somebody else work it. And they came to me first. The other two techs were waiting to see what I said. I was like, well, I wasn't waiting to see what y'all said because I knew I was not working till 10 or 11 o'clock. And 7 o'clock was the latest. Now so they got some other guys to come in and do it. It didn't last but a few because nobody was coming out at 10 o'clock at night to get an MRI. And that's where us as techs sticking together on the jobs and saying, okay, if you say no, now if you say, yeah, you're going to work it because I'm not, and being willing to walk away is a big thing as well. Some people can't, I know, but if you're going to be miserable working something, go somewhere else and find another job that fits your time schedule.
Exactly. And there's that one of the bigger hospitals, they have tried to reach out to try and recruit me, but all the new contracts that they are having, because they are a union, because it's a hospital, it unfortunately does revolve around alternating weekends,
Mm.
which maybe in the future I'll be up for it. But right now, mm-mm.
Get
And they
Lazula's
pay
right.
really well. They're one of the hospitals here in LA that pay the most for like techs, just period. But yeah, weekends, no. It's not gonna happen for me.
I tell people it's not always about the money. Money is not always your negotiating factor because just because you make a lot of money does not mean that's the right job. When you're negotiating, negotiate your call, your time off, whether you work weekends, whether you work, like whether you work at 312s or 410s, whether you work 5/8s, you should be negotiating all of those things. How do y'all work holidays? Some people have put in their contract, I don't want to work New Year's because that's my anniversary, or I don't want to work Labor Day. That's my anniversary. That's my kid's birthday, or whatever it is that's special to you. You can negotiate those things. They can
You
say,
can.
oh, yeah, but it doesn't hurt to ask. It's not always about money.
Yeah.
You can get money anywhere. I'm gonna tell you, places will pay you. It's just
Places will pay you, registry will pay you. You can work overtime 100 hours. You're gonna get the money regardless. If you really want that, you're gonna get it. But not for my mental health. My mental health in mammography, yeah, we're sticking to jobs Monday through Friday. No weekends, no calls, no holidays. And even then, I still don't work full time for that same reason. I'm like, no, my mental health is a little bit better. I'm going to spend more time with my family.
let me
So
ask you about that too, because sometimes people think mammography, there are no PRN jobs in mammography. There's no way I could travel as a mammography tech. Tell us what the opportunities are with that.
you can actually travel with mammography. There's a lot of jobs that you can find online that will provide you 13-week contracts. That's one way to go about it. You can also do local travel, which is what I'm currently doing. And I simply inform them what days I am available. I'm very flexible with my schedule. So I'll say Monday through Friday, 3 days out of those weeks, I'm yours, wherever you need me, type of thing. From there, you do have to have an interview with the manager of the facility that they want to place you at. And that's when you can really fine tune your schedule and your hours and so forth. So for one facility, for the outpatient center, I was there only 2 days a week, but I was doing 10-hour shifts, which I've always wanted to do a 10-hour shift. So I was all for it. I was all for it. 2 days a week, absolutely. Yes, I'll be there. And I don't have to do anything else for the rest of the week. Absolutely. Now I'm doing 3 days a week, 8-hour shifts. Again, works perfectly now for my schedule. Once second baby comes, who knows? Maybe we'll try and do a 12-hour shifts here, maybe 3 12 hours. I don't know yet. Still looking, but there's so many opportunities in mammography. You can do full time, you can do overtime, you can do part time. And mammography right now, just as a whole, there's so much need for mammotechs. So whoever you go with, they will work with you on your schedule, period, because that's how desperate they are right now. That's how much we need mammotechs because not a lot of mammotechs out there. There's not.
Yeah. A lot of them retired after the pandemic.
For me personally, I work with a lot of older women who have been in the field for quite a while. So they're not always super forward with sharing the knowledge. I was very, very lucky that to work in a facility in a breast center where that's not the mentality. The mentality is everyone needs to know everything,
Mhm.
period. Everyone needs to know how to do mammograms, screening diagnostics, biopsies, and then you still need to know how to perform breast ultrasounds, biopsies, and it doesn't matter that you're the brand new person, you're going to learn all of this within the next year, kind of a thing. So, coming from a facility where they were very much, well, you're new, you're only going to stick to screening. Maybe every so often I'll let you watch me do a diagnostic, to going to a breast center where you learn everything, you really get to see like how amazing it is. And when you get new techs, and it was my turn to train them, it was like, let me show you why mammography is amazing because this is everything that you can do. And these mammo-techs that I train, again, you can literally see like the little light bulb in their eyes and everything. And they end up falling in love with mammography because of it. Because you're not stuck just doing screening diagnostics. You can learn how to do biopsies, you can learn how to scan. And once you know how to do it, it's again going back to the MRI techs. When you have a background in mammography, everything clicks. When you're performing breast ultrasounds or breast biopsies, again, it clicks if you know how to do mammography. If you're the one tech that like does everything. So I think it's beautiful. I think it's great. And I think the more knowledge we can spread and help each other, like it's just gonna make mammography as a field a lot nicer and a lot more welcoming environment for everyone. Because again, I do feel like sometimes it is painted not in the best way, but if you're in a facility that it's not like that, then you'll be the first person. You be the first person
Yeah.
to do that. So,
Yeah.
and then wherever you go next, you make sure you continue being that person because then you're going to help everyone. And everyone in mammography knows everyone. So,
Everyone is
mammography is a very small field.
well,
So,
so is radiology, the whole medical imaging. All of medical imaging is I had someone on my podcast and he was like, "We work together." And I was like, "We did?"
remember,
But we worked in the same hospital for years, but he was in nuclear medicine and I was in MR and I was in CT before that. So I worked closely with the nuke med test. And then when he started talking, I was like, he kind of looks familiar, but I never could really remember that we worked there together. But he was totally he remembered everything, and I was like, "Obviously, we
you're like,
work together." But that is such a small world in the medical imaging. Even just in the United States, we all kind of know each other. You're going to cross paths with everyone, and I love that you said even if you find yourself at a facility where sharing the knowledge is not the norm. That I was in that situation when I went over left and went to I was not welcome. Literally gave me 30 days to learn a whole different profession.
mhm,
MRI. Had never done anything but radiation. Giving somebody 30 days to learn it was obviously for me to fail. And there was nobody for me to help, for nobody there to help me. And it took literally every day going in there for 30 days straight and just sitting there standing over people watching because nobody would show me. They clicked so fast, so I couldn't see stuff. I mean,
yep,
and I didn't know what an MRI machine even looked like. I didn't know what a 5 Gauss line was. I was thrown into the fire to fail. And I feel like unfortunately, many of us have had that experience, but this is why social media is so important. This is why this podcast is important. Us talking about you can rise above all of that. I mean,
Absolutely.
you can go into situations like that, but if you keep your focus and you know why you're going into the profession and remembering that mammo is a field that is highly paid. I just want to say that you guys are not like getting paid pennies. You guys are paid well. Your job is not sitting down just doing easy stuff, and it's not a lot of busy paperwork. You are highly skilled. It takes focus, empathy, kindness, and professionalism to do what you do. You see a variety of exams. You can
Mhm.
work in different types of mammography lines. You can do leadership. You can do screenings. You have different patients each time. You can do diagnostics. You can do biopsies. There is working a breast center, outpatient center, in a hospital.
You
There's
can
so many
teach. Teach.
you can teach. There are so
Yes.
many things you can do with mammography that I think are not really highlighted. And yes, in every profession, you have people that are miserable and not happy. I mean, everybody doesn't wake up on the right side of the bed, but as you show, you can still excel in the profession and inspire other people who come in not to have the experience you have. And that's been my goal too. When people work with me, I want to make sure, unless you just woke up on the wrong side of the bed and you just want to be miserable, you work with me. I'm going to try to show you what I know. If you want to know it, I'll try to show you, but I'm going to make sure you have a positive experience when you look back on MRI if you worked with me. And the same
Exactly.
with you for mammography.
And the reality is with mammography, like I don't think people really realize how many doors open to you, even as far as like jobs are concerned, because if you have a really good relationship with the other mammotechs and you're open, you are willing to learn, you're willing to share your knowledge and everything, that translates to everything that you do. So the radiologists take note of that. The breast surgeons take note of that. And guess what? When they go to a new facility because they got a better offer, they're bringing you with you. Like, that's kind of the way that it works.
Oh,
It's amazing because if you are tired of working at a specific place or you just want something new, like so many doors will open to you because they already know your personality. If you want to be in management, if you want to be a manager, the fact that you're willing to share your knowledge with others, that you can communicate well with others, have a positive relationship with everyone. Again, those qualities are what's needed if you want to be in management in mammography, not the bachelor degree. That's just an extra, but it's the personality and everything that goes into it and how you like present yourself. So, so many doors open. And I can definitely say that has happened in my case. And that's something that I'm super grateful for. But I also want to make sure that the new generation of mammotechs that are coming in, at least the ones that I've met, like you want to be that person. Don't hold anything back. Like that does not benefit you in any way. And as a department as a whole, your department is not going to thrive unless everyone is on the same page.
yeah.
So, and again, I've seen that. I went from a breast center facility to an outpatient facility where it was not like that. Within 6 months, it became like that because so again, the personalities and everything. Sometimes you're just not one person to, you know.
Yeah.
So my thing is like you be that one person. You be that one person to make everything a lot better. It'll be better for the patients, better for management. Everyone will be happier and you will love your job in the process. And so many doors will open up for you. So
You just summarized all the reasons whether you are going straight out of x-ray school and graduating to pursue mammography is one of the easier professions to transition over into from x-ray. Not the easiest profession. Let me make sure you guys understand that correct. There is no easy in medical imaging. Everything takes skill and hard work. So mammography is not like, oh, it's just an easy job. But it
no,
is
it's not.
easier to transition
Yeah.
from X-ray school and being an X-ray technologist over to mammography. And it's also a good place to be able to gain more skills as far as patient care. You're able to have a more flexible schedule. You're able to have weekends off at most places, unless you work
Yeah.
at that one place in LA.
We don't talk about, but they're great. They're great.
But you got to decide what you want. Do you want the or do you want the weekends off? So everything's about choices. Not and neither one is bad. It's not a bad thing. I worked weekends, but they paid me like $10 extra to work on the weekends. I took those weekends. I worked those 4 hours because for me, I could make more money in those 4 hours with that $10 extra on top of it and wouldn't have to go in there during the week and deal with the personalities that were there during the week. Things change. That's the good thing about technology and the advancement of the profession. Since I've been in it, PET came about. Different modalities are coming up, and now you have AI, the remote scanning, things like that for MRI. There are a lot of things that's coming in, opportunities for a lot of people. And when you talk about the importance of sharing your mammo knowledge with other technologists without competition, and which is important. In every job you have that, but why do you say it's important to share the knowledge that you have as a mammography technologist?
Again, there you go. No, as long as it makes sense and as long as it works for your family, just do it.
So
If it doesn't work for your family, go somewhere else. Just keep
yeah,
looking.
mammography has options as well. And that's what I want people to understand, that whether you're a technologist that's burnt out, don't let mammography just pass you by. Look into it. You've heard the opportunities and a positive spin on it. Someone that enjoys the profession, has had opportunities within it. And what last motivating comments or would you recommend to technologists who are out there saying, I'm thinking about mammo or I'm not thinking about it? How would you sway them over to looking at a profession that you don't have to cut into your full-time job by going back to learn about it? You can do it in a course online, get your exams at work, or go get a course that offers the exams, some of the pluses.
I would just say to try and be as open-minded as you possibly can. Give yourself a year if you can. Even if it's only 6 months, that's fine. But give yourself those 6 months to a year to really dive into mammography and just really get to know it and understand it. And I personally think the enjoyment is just going to come out of it. But to each their own. But if you do need help with mammo, they can always send me a DM. I'll answer any of their questions. Or the cards that I sell that always helps. That has helped a lot of mammo techs.
I think you said a lot, and your positivity about the profession says a lot as well. So you're very genuine talking about your profession. You made some really good points for high school students to really take steps while you're in high school, and parents to work with your kids to help them to see. And also those of you counselors out there in high school, look over at radiology and let your students know about this profession. We are the third largest medical profession in the nation, and we have over 11 modalities in our profession. People have options when they go to school for radiology technology and become registered by the ARRT. We are licensed, credentialed medical professionals, and we take care of you, helping doctors to diagnose and care for our patients. So, Zulema, it's been a pleasure having you on, and I look forward to continuing to engage with your TikToks. And you guys, be sure to check Zulema out over on TikTok. What's your TikTok name?
Breast Friend Boutique.
Oh, that's so cute. How did you come up with that name?
Well, I don't know, breast. I'm your breast friend. That's what I always tell my colleagues. I'm like, I'm your breast friend. Just come to me and I'll love you in any way. So it kind of just started off as a joke and then developed into that. And here we are.
You have an Etsy shop called bestfriendboutique.etsy.com, and you have a TikTok page for a breast friend boutique. So very smart. And thank you for your 10 years of being a mammography technologist. And you all, thank you for listening to a couple of rad techs. You can find all of the links to reach out to Zulema at Best Friend Boutique for her Etsy shop, her TikTok. Be sure to give her a follow, hit her up in a DM so you can learn more about mammography. If you're a technologist struggling to stay afloat in the radiology world because you want to do something else, but you don't have the time, the energy to go back to school, stay tuned to a couple of Rad Tech's podcasts. I've got some amazing things coming up, all on mammography, because guess what month is coming up soon? October. That's our best month ever. That was funny. That was funny. It was the last minute thought you got. Anyway, you guys check Zulema out and stay tuned to a couple of Rad Techs. We've got some amazing things coming up for technologists and patients as well, talking about breast health. You know how I do it in October? We're going to be doing it big leading up to October. So stay tuned. Got some good giveaways and some really good information. Until the next time, thank you for listening. Be sure to leave us a review at a couple of Rad Techs. See ya. And